actually Luzerne County.
Well, that was a great sound effect. Welcome to Hazleton Area High School. Oh, the lights go dim. You know, unfortunately, we don't see the people who should be here. You know, this is such an important topic, and I know it's 5:20 people are working, so I'm hoping some more folks turn up. We've held these town meetings, and different organizations have about the opioid and heroin epidemic all over the area. And whatever time of day it is, unfortunately, the crowd, we get decent turnouts. We've covered events like this as from Eyewitness News, but the turnouts aren't, I would think, what they should be. So hopefully more people will show up. But I'm going to give the lawmakers, especially Congressman Lou Barletta and State Representative John Yudichack and Tarah Toohil, for organizing this event tonight. I know this is the third one set up by the congressman around his district. I want to give him a lot of credit, and those who are trying to do something about this opioid and heroin epidemic. Let me introduce the panel first of all. And by the way, we will be live on Eyewitness News briefly throughout the next 2 hours. So it's a family-friendly program. The camera will be panning the folks here. So, you know, if you see that, the big guy there with the camera with the red shirt, that's Jason. He'll be panning around once in a while. So some of this will be live, I'm not sure when, on Eyewitness News, WBRE, and WOW TV. Let me first of all welcome everyone, introduce our lawmakers. Of course, Congressman Lou Barletta from the 11th District is the main organizer of this event. He'll be making a few opening remarks shortly. Sitting next to him, State Senator John Yudichack from the 14th District. John Yudichack. State Representative Tarah Toohil from the 116th District. And really, I have to point out, they have really been doing a lot of bipartisan work on numerous issues, these three lawmakers. I want to give them also kudos for that. Not just this situation, but issues facing our community. They've been bipartisan. Politics has not played a role in it whatsoever. We have Police Chief Jerry Speziale from Hazleton City Police. We'll be also talking tonight. Luzerne County District Attorney Stephanie Salavantis from Luzerne County, of course. And I believe that is John Knowles, a counselor for the Clearbrook Treatment Centers, one of the premier treatment centers in northeastern and central Pennsylvania. And Mary Pascucci, who's a pathologist who unfortunately has done the autopsies on some of the folks losing a battle that have been lost to this heroin and opioid epidemic. And then we'll have questions that you folks wrote down and gave to our staff. We'll be asking these questions of our panel members a little bit later on in the program. And anything comes to mind during the program, a question, whatever, feel free to let me know or someone in the front here know, and we'll ask that question of the panelists. Let me start off by introducing, first of all, our first opening remark with Congressman Lou Barletta. Congressman?
Thank you. First of all, I'd like to thank Andy for taking his time to host this event. It is so important to our community and to my friends John Yudichack and Tarah Toohil and our great panel that we have here tonight that hopefully will shed some light on this epidemic that's sweeping the country. I think it's very important to do events like this to bring awareness to how severe the problem is. Every 25 minutes, a baby is born addicted to opiates. Every 25 minutes, think about that. First breath of life here on earth is as an addict, and what that baby has to go through to come out and have a normal life. 91 Americans die every day from opiate overdoses. Since 2000, there has been a 200% increase, in the rate of opiate overdose deaths. There's no question this is an epidemic, and it's really going to take the federal government, the state government, local government, and the community to come together to do something about it. I could tell you in Washington, politics has been put aside to fight this problem. In the last omnibus bill that we just passed, we have allocated $1.1 billion for the opioid crisis. That's a $781 million increase over last year's budget. We've increased the Department of Health and Human Services effort to fight opioid addiction from $150 million to more than $800 million. $1.8 billion for substance abuse prevention and treatment grants. We fully funded the Comprehensive Addiction and Recovery Act at $181 million. That is the most sweeping bipartisan legislation to address heroin and opioid epidemic. So people in Washington not only recognize the problem, but in a tough budget climate are coming together and making sure that we have the resources. But as I said, that's not going to be enough. We're going to have to work together as a community, state, federal, local, and community to recognize this problem and hopefully overcome it. Again, I want to thank you all for coming, for taking your time. Thank you.
And now, State Senator John Yudichack.
Thank you very much, Andy, and appreciate you and WBRE. Always great partners when we get together as a community to address one of our challenges. And there's no greater challenge in Pennsylvania and really across the United States of America than the opiate epidemic. When you run through the numbers and you recognize they are not just statistics, they are families that are being broken by addiction. In our culture, it's very difficult to talk about drug addiction. But as the Congressman has mentioned, and I want to thank Congressman Barletta and certainly State Representative Toohil, we have worked on a number of issues. And we started back in 2011 when Congressman Barletta and I formed Operation Gang Up to address the rising drug violence in our streets. We recognized that the game was changing in our schools, in our communities, in our neighborhoods, and we put together a professional task force that brought together experts and recognized not only did we have to get more resources to law enforcement, we did that, mobile street crime unit at the Attorney General's office. We recognized that we had to put new laws on the books so that we can combat gang activity. We did that with Pennsylvania's first anti-gang law. But we also recognized the best way to prevent addiction, the best way to prevent our young people from falling into the grasp of drug addiction was education. And of course, the SHINE program in Carbon and Schuylkill counties, and now here in Luzerne County, working with Congressman Barletta, we have been ahead of the curve, if you will, in trying to tackle this opiate epidemic in Pennsylvania. The numbers are staggering. 140 deaths in Luzerne County last year is 4 times the rate per capita of New York City. That is not a distinction that you want to have as a community. We clearly are addressing the issue on many fronts. I've never seen an issue garner as much bipartisan support as the challenge that we face with the opiate addiction. Over $50 million in the last 2 years, thanks to Congressman Barletta's efforts. We've secured nearly $30 million in Pennsylvania from our federal partners, in addition to $20 million that has been put in state funds to battle this issue, to get in the hands of law enforcement, to get in the hands of treatment centers, 45 treatment centers across Pennsylvania. That Governor Wolf has stepped up in a big way to work with the Republican General Assembly, particularly one of my colleagues, Senator Gene Yaw, who's done an exceptional job in advancing many legislative efforts in dealing with monitoring prescriptions, dealing with changing the culture for our physicians and how they prescribe these opiate drugs. And so I have never seen a response on any social issue that has garnered more bipartisan support. You hear far too often that Washington is broken, Harrisburg is broken, that we don't work together anymore. On this issue, as you see here tonight, we are working together to battle this very challenging issue in our community.
Okay, thank you, Senator. Now, Representative Tarah Toohil.
Thank you, Andy. Thank you to all the attendees tonight. Particular thanks to Congressman Barletta and Senator John Yudichack, who have been role models to me since I've came into office on how to work together. People were very surprised by Republican and Democrat speaking with each other at times when they don't have to, and then working together on really important issues. Senator Yudichack has been a leader in funding, because a lot of this is money, trying to get money to the problem properly, like where can we apply money, where can we apply funding in order to help people. And then Congressman Barletta in particular has been working on the issue of drug-dependent babies and the babies that are being born right now in our communities that are drug-dependent, which are voiceless, innocent children that are many times, tragically, they end up dying, and they get put into the foster care system. So that's something that I want to thank them both for their leadership on. With regard to Pennsylvania in particular, Pennsylvania has at least 10 people a day that die from some type of drug overdose. So this is a tragic public health crisis. I think we've ripped off this stigma where it used to be, even a year ago, 2 years ago, people did not want to talk about this. People were blaming drug addicts, that there's something wrong with them and that it's criminal. And I think now we're starting to see that there's a human element to this, that when people become addicted to opioids and heroin, so much is out of their control. They lose their job, they lose their family, they lose everything, and there's nothing stopping them from going and getting that next fix. So I think the embarrassment and the hiding in the shadows, families not wanting to talk about it, it used to be so taboo, but now we open up the newspaper every day. Within 3 days, you open it up again and you're like, oh my goodness, 52 years old, 23 years old, 17 years old, what is going on in our community? And it's obviously far worse of a problem for us in Pennsylvania than it is in other areas. We had the governor's office, and he's been a huge activist on this, that there has been as many as 5,000 drug overdose deaths in the state last year. And that was the number that Senator Yudichack was addressing, 5,000. That was a 42% increase from 2015. So the drugs are there, they're accessible, they're cheap. And we need to tackle all of the sources of this problem. If it's doctors are being pushed to overprescribe, doctors are being pushed to keep patients happy. The big pharma is out there. Their job is to sell drugs, have people consuming drugs. And then we have the issue of illegal street drugs as well, which everyone knows here, unfortunately, in our area, that heroin is so cheap and so accessible on our streets. So I think this is great. If people couldn't be here tonight, I hope they're reading it in the paper and that they'll come forth, contact us if you're having problems, and we can hook you up with the right kind of mental health counselors and the experts that are all down on this end of the table. We're very happy to hear from the panelists tonight that are dealing with this on the ground every day and look at solutions and where we can go forward in stopping this increase and then chipping away at the problem that we have, and hopefully in large chunks, and that we can put a stop to it and help our youth. They're not really here tonight. We don't have as many youth, but that we start really talking to our kids about drugs. Nowadays, not when we were growing up, they didn't say this, but now we tell our children, this could kill you. One time using a drug, one time the wrong pill, one time with a marijuana laced with something else that you have no idea what it is, it could literally kill you. And they should be that scared of trying that first drug and doing that. So I'll leave it to the experts, but thank you for this forum and thank you for your leadership.
Okay, Representative Toohil, thank you very much. Let's go right to our panelists now, and we'll have opening remarks from Hazleton Police Chief Jerry Speziale.
Thank you, Andy. Good evening, ladies and gentlemen. I've dedicated my entire adult life to the law enforcement profession, serving at the federal, state, county, and local levels, in a career that has thus far spanned well over 37 years. I've been shot, confronted with every type of foreseeable danger, shared the pain of families who have lost loved ones to senseless acts of violence, drug addiction, and have spent countless sleepless nights trying to make sense of it all while searching for answers. From the streets of New York City to the fields of Bogota, Colombia, I stand before this body today to tell you in all honesty that the scourge of heroin and opioid addiction is one of the most formidable foes I have ever faced in my law enforcement career, and which confronts us today as a nation. The tenacious grasp of heroin on whole communities, that addiction can break the backs of even the most resilient, while destroying families and, as I said, whole communities. The unique and acute pain associated with the withdrawal from heroin addiction is legendary and has unfortunately for many proven to be a mountain too steep to climb. Personally, while working undercover overseas in South and Central America, I observed firsthand the massive amounts of heroin being smuggled into our country from Colombia and Mexico. The cartels have become masters of invading our borders with a product so powerful and profitable it has caused an epidemic in the United States, the likes of which I have never seen before. Well, in Colombia in the early 1990s, I witnessed the cartels begin processing heroin by using chemists from Southeast Asia and the Middle East, because the profits were 3 times that of importing cocaine, which in itself is a multi-billion-dollar empire. The resulting compounds produced a product that's 95% pure compared to other heroin, cementing their grip on their users and producing an addiction cycle so strong that it seems nearly unbreakable. The most recent threat we face is the introduction of fentanyl, a synthetic opioid from China, which is sent through the mail system and then interlaced with heroin here in the United States, resulting in a product that is 90 times stronger than morphine and causing an untold number of deadly overdoses. And while the recent introduction of Narcan into the hands of our police officers has helped to save dozens of lives on the streets of our city, not including the doses administered by EMS, Narcan has proven less reliable and effective in those cases in which heroin was laced with fentanyl, often requiring higher doses to even have a chance of revival. All of this has converged on the streets of Hazleton and other cities across our nation, littering our sidewalks and our shelters with an increased number of those who are homeless and addicted. It has served as a main driver of crime and disorder. It has taken our brothers, our sisters, our sons, our daughters. It transcends race, gender, and social class. And its shadows has touched all of our lives in one way or another. Recently, an officer told me a story of stopping a young girl early on Easter morning in another jurisdiction who was aimlessly wandering around the streets, seemingly in a fog. She turned out to be the daughter of a police chief from another state. Stories like that are not unusual. No one is immune. Heroin took my brother-in-law. It also took my first cousin. These experiences are all too real and all too common. I have seen it from every conceivable side. It's a problem that requires a united front and a cohesive and steadfast commitment if we ever hope to make any meaningful inroads. The first step in solving the problem is admitting you have one. The next step is having the will to battle against it every day. So I'm here tonight to do whatever I can do to help us fight this scourge of this terrible national epidemic. Thank you.
Thank you, Chief Speziale. Now we'll hear from Luzerne County DA Stephanie Salavantis.
I want to start by thanking everybody for being here. This is a topic that is very important to the communities throughout all of Luzerne County. I go around and I speak to a lot of community organizations throughout all of Luzerne County. And this is the one topic that everybody wants to talk about. It resonates with everybody. And as the chief stated, this disease, it doesn't discriminate. The faces that we see, the people that are suffering from this disease are the people that we are surrounded by, our loved ones, our friends, our family, everybody. And so this is a very important topic. As State Representative Toohil stated earlier, it's ironic to me. This topic, not too long ago, was a shameful topic. No one wanted to talk about it. Everybody was ashamed to say my sibling, my family member, my friend is an addict. And it really affected the community. I went to an overdose awareness event last year, and I met a family. I met this mother, and she approached me, and I will never forget that moment. And she hugged me and just started crying on my shoulder. And after I was able to calm her down, she started telling me how her son passed away from addiction. He was a heroin user, and she was made to feel ashamed. She was made to feel that she couldn't express her emotions. She couldn't talk to anybody about it because how dare she raise a son that suffered from addiction? And she was thrilled and just so emotional over the fact that I was at this event publicly talking about how no one should feel ashamed, that this is something that affects all of us and that we as a community need to work together to address it. And that is something that is the topic that is so important. That is the message that needs to be sent out there for people to start really understanding. In Luzerne County last year, we had 141 deaths as a result due to overdoses. Can you believe that? It's higher than car accidents and gun violence. That's what we're dealing with. Just in Luzerne County, and as was stated earlier, nationally, this is not something that is any different from any other area. We are not different. This is just an epidemic. Just to give you a little bit of insight, in 2015, we had 95 drug overdoses, and 2014, 67. Think about that spike. And in 2017, we're on mark to meet or exceed the number from 2016. We need to do more to stop this number from increasing. And I'm sure the chief will attest to this. As law enforcement, our role has been to be reactive. When a crime is committed, we react. We help the victims, we investigate, we react to that crime. Now our job is to be reactive, but also proactive when it comes to certain topics. And this is a topic that law enforcement has paid particular attention to. We're doing everything in our power to stop these numbers. Luzerne County, I should say, District Attorney's Office has recently taken over the drug task force. We are putting, Hazleton is a huge part of it. All law enforcement throughout Luzerne County is putting as much resources into the drug task force as possible so we could stop the sale of these drugs. Because if we could stop the heroin that's laced with fentanyl or pure fentanyl from being sold on our streets, we can maybe save one person or multiple people. So that is one of our goals from law enforcement's perspective, is to stop the drugs from coming into our communities. It's terrorizing our communities. We're doing other things together, as the chief mentioned, using Narcan to help when someone is overdosing and trying to save their lives. We're putting prescription drug boxes throughout all of Luzerne County to try to get the drugs out of the homes so people aren't burglarizing families' homes or sneaking into different places to try to take their friends' parents' drugs, or kids going into their family's prescription box and taking drugs and sharing it with their friends. That's how it all begins. So these are just a few of the things that we have been doing from law enforcement standpoint. This is a fight we have to do together. We have to work on this together. Legislators, law enforcement, the community, providers. We need to do more together. And I am very vocal about saying that we can't arrest our way out of this. We need to provide more treatment, more programs for these addicts. Because until we do that, there will be no change. We need to help address this disease, and that's what it is. Thank you very much for inviting me here tonight.
Thank you, District Attorney Salavantis. Now we'll hear from John Knowles from the Clearbrook Treatment Centers. John?
Thank you. Just want to thank Congressman, Senator, Representative for having us here on behalf of everybody at Clearbrook. I think before we start, I would just like to say, personally, I'm a person in long-term recovery since November 29th, 1984. And I'm a product of the last epidemic that we had, and that was the cocaine epidemic. And cocaine and pills ravaged my life, ended up becoming suicidal. My father showed up, and they spirited me off to treatment, where I spent 42 days. And two members of my family each got about a week of family therapy, and I was able to go to 2 years of aftercare, and by the grace of God, for the last 33 years, I've been able to remain abstinent and lead a pretty productive life. And in today's world, that kind of a treatment plan is akin to winning the lottery. You wouldn't be able to access that. I believe in my story that, I've broken the cycle, and that I have 3 sons who two of whom served our country as an Army major and a Marine corporal. I have another son who plays pro lacrosse. I mean, these guys had a different life because people like each and every one of you who showed up tonight, who sat here on this panel and who make policy, took an interest, and people like me were able to make a change in our life. And I believe that that's possible and true for what we're doing here today. I think I'm a best practice. You suit up, you show up, you work hard, you get people involved, and things we can make a difference. This heroin epidemic as a treatment provider and from a treatment standpoint has been devastating for us. It's like standing in front of a 50-foot wave. At Clearbrook, in 2013, about 56% of the people who came to our facility indicated that heroin, prescription narcotics, some type of opiate was their drug of choice, primary, secondary, tertiary. At that point, about 69% were male, 31% female. A year later, it went from 56 to 59%. Same numbers, males and females. A year later, it became over 70%. And we stay steady there. So to give you an indication, 7 out of 10 people who come to our facility have some sort of heroin, opiate, or opioid-addicted drug of choice. That changes certainly our treatment approach pretty significantly. But however, the population that's showing up is actually risen in terms of more of a middle-class population, more of a cross-section of what we see on a daily basis. The other issue that we've run into is some really significant negative consequences of the Affordable Care Act. Led to the proliferation of a lot of what we would call investor-funded treatment operations, where because it was mandatory and because there was a lot of money out there for addiction treatment, we became the darling of Wall Street and hedge funds. And what happened was there was a proliferation of these programs and office-based programs that really excluded large segments of the opioid-using population. Most people, when they use opioids at the end of the road, don't have access to a lot of resources. Many of these programs, as we said, relied on self-pay or out-of-network benefits and excluded any form of public funding, because the public funding that came along with this CARE Act results in about a loss of $100 a day for a provider, and you can't make that up in volume. And so while we provide this care as a nonprofit, we certainly pay a price for that. The other issue is that, you know, most of these addicts can't afford the $20,000 to $30,000 it costs to go to a private facility. And also, you know, there's, in these office-based programs, the proliferation of these have tripled. However, most relies on cash basis, or, not all, but a good number of them. And it's about $200 for an office visit. And so trying to get in, if you have public assistance, or if you are poor, or if you have used up all of your resources to get high, securing a bed in a treatment center is akin to winning the lottery. You really have to, anywhere from a 2 to 6 week waiting list is possible, and yet there are other facilities, and right here in our county, and we might as well say it out loud, that there are places in this county that run at about a 60%, 50% rate with empty beds, and yet I've got a 2 to 3 week waiting list with people, you know, grandmothers, and that's who I talk to, grandmothers and moms, and Mr. Knowles, please, can't we help our son? Never in my wildest dreams did I think that one of my best clinical skills would be sitting in somebody's kitchen talking about their dead child. But that's what happens with this stuff when people have to wait. The CDC data, you know, if you go and you look at the Centers for Disease Control, what we're seeing is that some of these medically assisted treatments are really symptom management treatments. That it says medically assisted treatment where you should get some sort of substance and treatment to follow. We're not seeing that. We're seeing people who go and they get the prescription. Of note should be that you know, the 3 largest killers of prescription medications that people overdose on are methadone, oxycodone, and hydrocodone. Methadone is one of the agents that we use to try and get people off of heroin. Doesn't mean that everybody who uses that, there's a population out there that needs that. There's a population out there that needs Suboxone, but it certainly is not our first intervention. It's not the first line of defense that we want to use coming in. So as we move forward, there's a lot of issues, certainly for us as treatment providers, that we need to take a look at. As the chief very talked about, that the flood of synthetic narcotics such as fentanyl and carfentanil and different things have really changed our detox protocols pretty significantly, so that each individual who comes in, it has to be watched. We don't have a standard protocol anymore because we don't know how much fentanyl is in there, if there's fentanyl in there, what other cutting agents are people using. One of the phenomena of this drug is that individuals are really looking to increase the high, and so we see a lot of different cutting agents. And then we have individuals who have been using Xanax and Librium and other benzodiazepines in order to quell some of the symptoms of withdrawal. And while you cannot die from withdrawal from opiates, you can die from withdrawal from benzodiazepines, alcohol, and some other substances. So it creates a greater danger from the withdrawal from these substances, and it creates a longer detox period. At the same time, we have another issue that from an insurance standpoint, reimbursement for narcotics treatment has decreased probably about 20% over the last 2 years. Where we used to get 28 to 30 days, it has dropped down to approximately 21 days, with the idea being that the 15 to 17-day detox, once that's completed, a quick aftercare plan should be in place that includes some type of medically assisted treatment to move people along. Our perception is that will drop even farther, and that we will get somewhere probably close to 12 to 14 days in the next 2 years. And in all reality, if we simply are only going to detox people, that's very unfair. We might as well not do that, because the largest time for overdose deaths occurs right after an individual is either incarcerated or gets out of treatment, because they return to using, and they use at the same levels that they did before they went in, and that's how they relapse and that's how they die. So we've got a lot of issues and a lot of things pressing towards us. But again, on a personal level, I thank you for being here, and on a professional level, I thank you.
John Knowles, thank you very much. And our final opening statement from Mary Pascucci, who's a pathologist. Mary?
Thank you, and thank you for having me here. I am a pathologist, and a portion of what I've done has been autopsies. I came back to Luzerne County in 1996, so I've been doing autopsies for more than 20 years. I tell people last year somebody asked me how many, and the nearest I could give it was between 4,000 and 6,000. I have been at the disposal of coroners and coroner systems for about 8 counties. Since I've been here, the past 3-4 years, I've been concentrating mostly in Schuylkill and Luzerne. So I want to bring this a little bit more local and make this regional and give you some numbers. But first, I'm going to teach you. I get called because I'm the expert for cause and manner of death. And what I always tell people is, doesn't matter how you die, doesn't matter what the cause of death is. There are only 5 manners of death. That's it. There's homicide. You all kind of know what that is. There's suicide. There is something called natural. There is accidental. And there is the one category where you just can't pigeonhole it. We call it undetermined. What has happened, and like I said, being in this 20-some years and watching the drugs of choice through different counties, when I started in the 90s, I'd say probably the drug of choice then was still cocaine. I remember the first time and amphetamines, one of the first times that we actually had a heroin death kind of surprised me because I hadn't seen that in my career. Didn't realize it was going to be quite this trend that it's become. What opioid death has become across the United States is the #1 cause for accidental deaths in the population age 12 and up. That's a big change. There used to be different ages where we used to say trauma was the #1 cause. Well, this is now across the board, age 12 and up. The demographic, sort of interesting here too. The usual opioid abuser is a young to middle-aged white male. So there is your profile. Luzerne County, as I'm going to piggyback off some numbers. Luzerne County, 2015, 95 deaths due to drug overdose. Schuylkill County, 24. 2016, Luzerne County, 142. 150% increase since the previous year. Schuylkill County, 2016, 77. 320% increase. You got to keep something in mind. Schuylkill County has a population that is less than half the population of Luzerne County. I don't think this is a race anybody wants to win, but there's a problem. And the problem is not just county boundaries, it's not regional, it's not state. This is a national epidemic as we're talking. It's some of the stories are mind-boggling. I will give you one story. I want to reiterate what John was saying. A lot of the patients that I see were the stories that they just came out of rehab. They just came out of treatment. They were clean. And they're horrible. Almost 2 years ago, and to give an example, almost 2 years ago, there was a young woman. She was in her 20s. She had just given birth several weeks prior, and she died from an overdose. The young mom and she'll leave his baby behind. The interesting part is that's not really unique, and it's not something I would have remembered, except for a few months later. A few months later, I have a man on the table, and he dies from a drug overdose. And it was one of the cops in the room who said, "Oh, you know the family." And I said, "What are you talking about?" They said, "That was his sister a few months ago. That was his twin sister a few months ago. He got clean. Her death scared him. He got clean, and he relapsed." As I said, I've seen the change of drugs over the past 20 years as what I call a drug of choice. About 2013, and this is really nationally, fentanyl really started coming into the picture. What I want to make clear here is when we say fentanyl, there is a medically accepted form of fentanyl that is used. Sort of interesting. I'm going to give a little bit of organic chemistry here, and I'm hopefully not going to confuse anyone. If you tweak the molecules a little bit, you get an analog. And when you get an analog, it may or may not have a medical use. The part about making these analogs is that for that time, they are legal. China has made multiple analogs of fentanyl. Their first was acetylphenol. Then, I will say, we got introduced in this county middle of last year, 2016, fentanyl. The interesting part is, until it becomes a controlled substance, it's legal to sell, and they are able to get around the export ban. Fentanyl had such a unique design to it that it wasn't getting picked up in our toxicology, not our standard toxicology. I was seeing a trend, and it was the second time in my career I saw this trend. When I'm doing an autopsy on an overdose victim, there are what I call soft findings. We always wait for the toxicology, of course, for final results. But there are these things I call soft findings. I won't get into it. Nonetheless, I kept getting negative toxicology on young, healthy-looking individuals that looked like they died from a drug overdose. And I looked at the coroner, who happened to be in the room, and I said, "It's happening again." The last time I saw this trend was when bile salts became popular. So I knew there was something out there. We just didn't have the technology to pick it up. When we started using the synthetic toxicology panel and started with the fentanyl, started getting hits. And then on the blood of some of the negative ones, he sent back, and indeed it was there. So it's interesting. The dealers, manufacturers, no loopholes, and we're always playing catch up with it. I want to go just a little bit into the addiction here again. First, let me finish up with the analogs, and only because this is really scaring me. I do keep up with this. Carfentanil, we haven't talked about very much here. We haven't seen it in Luzerne or Schuylkill County. It has been in Pennsylvania. Carfentanil is another analog of fentanyl. It has no medical use for humans. It is accepted as a large animal tranquilizer in the veterinary population. It's deadly. It's more than deadly. Something the size of a grain of salt can kill. It's that potent. Veterinarians know, usually this is a liquid form for them. If they get a splash, a single splash in their eye is enough to kill them. There has been at least one case that came through my news media where a first responder was on scene, drug overdose, and was exposed to the carfentanil. They had to reverse the first responder. Fentanyl is an interesting drug for its absorptive properties. Fentanyl can be absorbed through skin, through mucosa, through oral mucosa. You can't touch it. Touching with gloves with a lot of these analogs is deadly. So other than sending first responders to possible drug overdose scenes in hazmat suits, I'm not sure how this is going to be addressed. Something that came across my news media today, and it's winding its way, they found it in another state. Heroin is laced, we're talking not only with fentanyl, but there's a new substance out there. It's heroin laced with fentanyl and carfentanil and another synthetic opioid. It's astounding. I don't know what the answer is. I sat through a webinar today put on by CMS. CMS is the Centers for Medicare and Medicaid Services, federal government. They're talking about the opioid epidemic and their treatment, if you want to call it. There was nothing earth-shaking and nothing earth-shattering about how they're looking at it or how they're dealing with it, but there's no real quick answer. In the medical conferences, they are trying to avert the opioids in the population by having physicians, the advice now is for physicians, if they have patients who have acute pain, to treat only 2 weeks with opioids. Their contention is if somebody is on an opioid painkiller for 90 days, they're going to be on it for the next 5 years plus. Also, the advice was in treatment of patients who are opioid addicted, very high relapse rate, we know that. Treatment without medication to help with the withdrawal relapses more than 95% of the time. We need more than counseling, we need drug treatment with it. They now are recommending that these patients get treated for life with medication because of the rate of death after stopping. I will say also that 80% of heroin users stated that their intro drug before using heroin was an opioid prescription medication. This is a difficult topic. I don't see a short answer. And as Stephanie said, we're definitely on par, at least in this county, and I can tell you for Schuylkill also, for meeting or exceeding the rate of last year. So, if anybody has any answers for this, we'd like, try to avert. Again, they're coming at this, but this has to be treated from so many different fronts, from prevention to treatment to Pennsylvania. I have a medical license to practice in Pennsylvania and New York. Pennsylvania has just instituted the Pennsylvania Drug Monitoring Program. This will help in one area, people who do doctor shopping. every prescription that's controlled that we give to a patient, we are supposed to go into the central base to make sure they have not been prescribed this by someone else. It's a tool. It's not the answer. But everybody's hands are full, and I said, I don't know what the answer is. But I don't foresee this ending either, unfortunately. So those are my thoughts. And thanks again for presenting this.
Well, Mary Pascucci, thank you very much. I have to tell you, you saw the programs, Scared Straight. We grew up with the Scared Straight programs where you go to a prison. I think MSNBC still does, lockup, that kind of thing. I had the, I don't want to say pleasure, of being in the autopsy room with Mary Pascucci. We were doing different stories on opioid overdoses, what's happening, pretty much what she talked about in a much condensed version. In that autopsy room, and I've covered numerous horrible crimes in 40 years, what a scary situation. And I thought to myself, if people saw the inside of this room, I'm not saying see a body per se, but they just walked in this autopsy room and saw the real thing, not a movie set, I'd be willing to bet it would have maybe some people click and say, I don't want to experiment. Just a thought. But we left there, Mary, and how you folks do what you do, I do not know. So anyway, let's start off with the first question, and I want to follow up. This was from a member of the audience talking about can you update, and I'll throw anyone who wants to chime in, feel free to. Can you update us on the implementation of the prescription monitoring program? What obstacles and challenges do you continue to face as you try to make it work efficiently, and what can be done to improve the initiative or make it move forward faster? That would be a state lawmaker question.
Sure. Thank you, Andy. The former Senator Pat Vance, who nurse by profession, led the charge on the monitoring program. One of the issues with getting it up and running was funding. The state budget situation last several years, over the course of two administrations, has, to say the least, been challenging. Now faces a budget shortfall of $1.2 billion and a projected deficit of $3 billion in the next fiscal year. So funding is the primary issue with rolling out what is a very important component of combating the overprescription of opiates, and we are trying to tackle this from several fronts to make sure that we are monitoring that we do not have patients shopping doctors to access additional prescriptions, using technology to monitor that situation. But we're also have passed legislation to change the curriculum in our medical schools, to better educate our physicians and soon-to-be physicians so that they understand the power that they have in their pen when they write a prescription. So on several fronts, we are tackling the issue of monitoring the prescriptions, trying to improve how those prescriptions are delivered, how they are issued, but primarily the major issue is resolved around funding.
Add to that, reported last month, this was positive news, that the number of people visiting 5 or more doctors or 5 or more pharmacies to obtain drugs, including opioid painkillers, fell by 70%. So that was we addressed that. We ran to address that with the House, the Senate, and the governor signing that bill. It was controversial because people didn't want information sharing, but it allowed pharmacists and doctors to have control and be able to do a double check. And when people are having this, when you're addicted, they're just so desperate, they'll go and they're going to try every avenue they can get to get the opioids. It said that the percentages were based on data from last year, and that the number of people visiting 10 or more doctors and 10 or more pharmacies fell by 94%. That was the amount of doctor shopping and pharmacy shopping that was going on. And it's one solution, but obviously then you have to look and say, where do you turn? These people are going to be desperate. If we're not doing preventative measures, if we're not having accessible treatment through healthcare for these individuals, then they are going to turn to illegal street drugs if they can't get it from the pharmacist and the doctor. So it's one small part of it.
Mr. Knowles, want to weigh in?
Issues that we, there's a dark cloud around this whole thing, because this is a man-made, we did this. Our scientists created, it was a perfect storm where we were looking to do end-of-life pain issues and came up with some really powerful opiates to address that, and it got marketed. The doctors got a bad rap, but they were told that these things were okay. We started giving them to everybody. We didn't have a real good tracking system. One of the dilemmas that we have with the opioid epidemic is that there's a big difference here between addiction and abuse. We get 55-year-old housewives or grandmothers who come in who have been prescribed these medications for a long period of time, and they don't have the standard addiction issues. They're getting it from the doctor. It's a prescription thing. And there was no way to tell how much, and I was at a meeting just recently in Lackawanna County where they talked about there were enough Oxycontin prescribed so that each person in Lackawanna County, man, woman, and child, would have 53 Oxycontin to put in their thing. And that the prescriptions ranged from 25, or 5 pills rather, to one prescription for 500 pills. So being able to track that is certainly going to make a difference. But we also know, and as the district attorney will tell you, once you can't get the pills, we force people out into the street, and we're seeing an increase in our over 30 population on heroin, where it used to be we just see those guys who came back from Vietnam that would do it occasionally, and or we're doing it on a regular basis, and it was a maintenance type thing. Now we see people using it, or their children or young people are showing them how to snort it or shoot it because they still have the pain issues or believe they have the pain issues, and they're being pushed off of the medication. So this is an excellent initiative and a great policy that's going to do a lot of good things. In the short term, we're still going to see some problems, I believe, and we are seeing those problems by not getting that. The other issue we run into is everybody leaves. If there's one thing you come away with tonight, it's that go home and clean out your own medicine cabinet. I had this conversation with my mother-in-law, God bless her, and she said she had a Loratab in there from probably 1984 when somebody gave it to her, and she never knew if she might need it, But, and you think about it, we all do that. You save something, you don't take everything. It's sitting there. That makes it very attractive. The number one drug of choice for kids today is prescription medications. And that's where it used to be marijuana, it used to be alcohol. It's an access issue. So the more of these that are prescribed, the more available it is to people, the more available it is to children, the easier it is to get hooked. Once you get hooked, you can't get them anymore. Guess what happens? Johnny turns to something on the street. It's cheaper, it's more accessible. Boom, boom, and then we're sitting at the funeral.
All right, thank you. Oh, Stephanie, go ahead.
I was just going to say, it's ironic. I had a conversation with a defendant today that wanted to speak to me, and this very topic came up. It was an older gentleman, and he couldn't get drugs from his doctors anymore, so he turned to the streets, and he turned to heroin, and he started stealing to feed his addiction, and it just spiraled out of control. But that was his story, and I'm sure the chief could tell you 100 more. That's what we're hearing, and that is exactly right. And going to the children going into medicine cabinets, we hear a lot about what's called the Skittle Party, as I spoke about earlier, where kids just grab whatever they could find in their cabinets, they all throw them in a bucket, And at a party, they grab Skittles, which is different color pills, and they put it in their mouths and swallow it, and they don't know what they just took. And that's frightening. That is absolutely frightening. So I agree. We have to do more to get the prescription drugs out of the homes as well.
Along those lines, a good friend of ours, Paul Brenner from Hazleton, this question: can we discuss the merits of a community-based drug collection van that will facilitate removing unused opiates from households, currently being very successful in Susquehanna County? I guess so. Easy answer, yes. But funding.
Yes. Thank you, Paul Brenner, for that. Paul has been advocating for this for some time, to have a mobile drug van, because right now what we do is the district attorney, Stephanie Salavantis, she will come to events that the senator and I have, or community people have, the congressman, and they will come and you can drop off your drugs if you're not using them, and she takes those drugs basically into custody. It goes to the DEA, I guess. Those drugs have to be collected, counted, and they go to the DEA, the Drug Enforcement Agency, to be logged and then destroyed. And one of our problems is finding an entity that wants to basically own this van. I know there is a Susquehanna County model where I think the district attorney there does that. But we do have in Hazleton right now, and I'm not sure what the hours are, and I think that's something we can be more public and vocal about, but you can go to the Hazleton Police Department to dispose of your drugs. So drop the drugs is definitely something in our homes that you have to take a look at yourself, take a look at your cabinet and your household, and get rid of drugs. You're not saving them for a rainy day, saving them for when you throw out your back. You need to get rid of them now and get them out of your house. We have instances where, senior citizens are having their neighbor over for a cup of tea, and the neighbor goes and uses the bathroom, and if they're an addict, they're going to take pills out of your house. So just getting rid of unused pills or locking them up is a huge part of this solution, getting rid of the access. So it's good to get that information out there. The Pennsylvania State Police, we had numerous meetings trying to get a mobile van, but they also can't take jurisdiction over this van. Like, where do you park the van at night? If someone would break into the van, there's issues there.
Senator Dietz or Congressman Barletta?
I would just add we've taken 100,000 pounds of prescription drugs through the efforts of the DA's office and our local municipal police departments. We also held, I happen to be the Democratic chair of the Environmental and Energy Committee. Gene Yaw is the chairman of the committee. He's really led the task force in dealing with opiate abuse. We looked at it from another angle. When folks, whether it's in the landfills or through their bathrooms, tried to destroy the drugs that they may have in their home, there's an impact on the environment. So we do have to look at whether it's a van in our community, whether it's more resources to our DAs across Pennsylvania, or more resources to our police departments, so that we can collect these prescription drugs and destroy them in a proper fashion.
Yeah, I agree. I think this is one of the many steps that we have to take to find a solution, to the problem, and hopefully some of the monies, the increased funding from Washington will go towards, through these block grants or however we need to do to help with this problem, whether it's through a van or through the DA's office. We have to expand access for disposal sites for prescription drugs. Often, unfortunately, your kid's first drug dealer is your home. It's right inside your medicine cabinet. So I think this is something that we can do without a lot of effort, and it's one step, but I think it's a step that as a community we have to make happen.
Okay, next question. Why can't the RICO Act be used against the gangs selling heroin and gunning down people in the streets? The RICO Act.
I'll take it first.
Okay.
Finish up. The RICO Act is used against, drug traffickers. It is used against gangs and people that are out there. So RICO is used, and so are CCEs. It depends on what the federal crimes are. It depends on how we use the statute. But you have to have a leader of an organization. You have to have the structure. You have to sometimes use wiretaps. It's not just a simple thing where you just say, we're going to use the RICO and we're just going to charge somebody with it. You have to have the complete structure of an organization, and you have to use all alternative means before we go into wiretaps and things of that nature, and then we can go into that RICO. I don't know if you want to.
Just so everybody understands, in the district attorney's office, we have a detective that is specially assigned to, it's the FBI Safe Streets Task Force. And what that means is that the Safe Streets Task Force is centered around investigating gangs, investigating violent crime, corruption, things of that nature within our county, and that's why I had a detective specifically assigned. We have had instances in Luzerne County where we have watched gang members, these organizations, and developed good cases and presented it to the U.S. Attorney's Office, and they have charged. So we have had many instances in Luzerne County, but as the chief stated, to actually file RICO, it's a more complicated action than going through just a selling of drugs on the streets. You have to show that organizational part of it. But we are doing everything to work closely from the district attorney's office, working closely with local law enforcement and all other state and federal agencies to bring all these agencies together and combat this issue together. And I would say we all have such a great relationship. We work so well together, and I think that is a great benefit for Luzerne County.
Okay, thank you. A recovery question. Are most of the recovery programs that people are referred to, addicts, the 12-step type? What kind of recovery if a family member...
It's certainly, 12-step programs have been around certainly since the 1950s. We opened up in 1972 as to begin addressing opiate and heroin, and 12-step programs per se, the usage of it, it's called 12-step facilitation is the model. There's a lot of fake news, so to speak, that surrounds a lot of treatment. What is medically assisted treatment? We've been using medication to detox people for, as long as I've been in the business. I treat 1,000 people a year. We medicate almost all of them to get down. 12-step facilitation is an introduction to what is the most successful long-term, what we have found to be the most successful long-term treatment programs like Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous. Individuals who engage in those programs on a lifelong basis tend to have higher success rates in conjunction with other types of services. I think where we get mixed up is that there's people misinterpret that it's only 12-step, or it's only medication, or it's only therapy. And all of these things together are what really allow people to be successful. And those people who are engaged in those kinds of services by far have the highest success rate.
Again, these questions, feel free to jump in, whoever feels they can answer it.
Hang on one second. Before you go on to the next one, I just want to, again, jump off right here with what John was saying. With the treatment programs, as I said, I just went to a conference. It was only 2 weeks ago. And what the recommendation now is to the medical community is somebody who was already addicted, who's an abuser, lifelong medication-assisted treatment. So they are not looking at a cutoff at some point. That was the recommendation at conference.
There's so many drugs that are out there, as you know, Suboxone, Vivitrol. In the beginning, when we first looked at, treating addiction, when Suboxone first came out, it was limited to so many doctors. They had to be specialists in addiction. There were only so many of them in an area. And then it was they could only have 25 patients. Then it went to they could have 50 patients. Then it went to they could now have 125 patients. The drug was too expensive. They wanted the person to be on it 8 milligrams, then 6 milligrams, and 2 milligrams, a quick detox, and then they expected that person that was addicted for so long to just be okay and go through the system. I always looked at it as, I'm so glad to hear that that's the new thought process, that somebody could be on it and live a productive life without being high on something like Suboxone. Because would you take insulin from a diabetic? You wouldn't. So I'm glad to hear that.
Okay, next question. Have you considered implementing drug diversion programs or programs that offer treatment rather than prosecute young adults, nonviolent offenders with these low-level drug-related offenses? Can you speak to any similar programs that exist right now in our area, Luzerne County?
We do currently have one. It's Treatment Court. That's the name of it, and it is for nonviolent offenders that we believe are truly truly have an addiction. And we actually work very closely. We have a steering committee, judge, defense attorneys, prosecutors. Everybody comes together and sits down, and doctors, and looks at these cases. And we work to try to help as many people as we possibly can. And we have a very great success rate. The problem is, it goes back to funding. I don't have the numbers off the top of my head, but we can only admit so many people in the program at a time. And what we're talking about at this point with the courts and with the actual steering committee is trying to find funding to allow us to accept more people into the program because we see such a high success rate. We are huge, I should say, I am a huge advocate for these programs, if you can't tell by now. We need to do more. Instead of throwing them in jail, we need to do more to address their issues and the addiction side of it. So we do have it. I'm very happy about that, and we are looking to expand. I am in the process of trying to look at different ways of having we call them different paths. Right now we have the nonviolent, they can't sell, that it's only, they're only taking drugs to feed their habits. That's the one path we have right now. I'm looking at possibly adding another path that allows people who have actually been picked up for selling drugs, because we are seeing, and I'm sure the chief can attest to this, we are seeing a lot of these individuals that we're arresting with PWID, that they're intending to distribute the drugs to only feed their habit. They're making money to feed their addiction. And so, in my opinion, they're doing it just because they're an addict. It's not that they are part of a huge mastermind organization. And so, based on different tools that and trainings that we've been part of, they recommend that you separate the two paths. So we're trying to find ways to keep just the user and the people that have been picked up for selling separate, but addressing both issues. So we are trying to expand treatment court.
I recently spoke at the graduation ceremony for the drug court. Judge Skorowski does an exceptional job working with the DA's office and all the ancillary support team. It's a moving experience to speak with the families. These are all not young teenage kids that find their way into addiction. Many of them are mothers and fathers, have small children of their own, and they have an opportunity to stay out of a jail cell and get clean. It is a smart investment. Governor Wolf, Secretary of the Department of Corrections, John Wetzel, are working hand in hand with the General Assembly, trying to find ways so that we can keep those that have this illness, and more professionals are recognizing this is a mental health illness, addiction, and it is much better to keep them out of a jail cell and find them a pathway to recovery rather than to end up in our correctional system.
Along the, probably going to a state lawmaker question, how will the proposed consolidation of the Department of Health, Aging, and Drug and Alcohol programs affect the abilities to fight this epidemic?
I have great concerns about the consolidation. We're keeping an open mind. As I mentioned earlier, when you're facing a $3 billion deficit, there's not a lot of good answers to getting to a solvent and responsible state budget. The Department of Human Services is one of the largest, if not the largest, state agency. Making that larger, making that more bureaucratic, raises some concerns for me, and whether or not we'll have the resources to focus on things like the opiate crisis. The Drug and Alcohol Agency was just created a few years ago. Gene DiGirolamo from Bucks County led that effort and has been a great champion. And so to consolidate those agencies, I recognize the budget crisis, so I'm keeping an open mind. I'm very concerned about the Department of Aging moving in also to that under the Department of Human Services. So I think we have to do our due diligence. All the standing committees in the House and Senate are reviewing that, working with the administration, whether or not this is a prudent decision, not only from a fiscal standpoint, but also in the delivery of the services that these agencies provide to the citizens of Pennsylvania.
If I can add to that, so this consolidation was a proposal of Governor Wolf's, and I've been trying to keep an open mind with it as well, because if you look at from the outside perspective that we have so many people that need services. So Department of Human Services, Department of Public Welfare as it was known prior, there's so many different areas. So there's aging, mental health, children and youth, Department of Drug and Alcohol Prevention. There's all these different bureaucratic stations that you can go to if you need help. And the county services they provide much of the services. So we have individuals that are hitting, they're kind of just bouncing around, they're with welfare, they lose their children, so they're dealing with children and youth. They should be getting drug and alcohol treatment. Their aging parents are having to deal with them, and there's a mental health issue, and then they're in the court system as well. So in looking at it, we're thinking, the whole system could be servicing that one individual that's impacting their entire family and the community in a different way, or a more efficient, streamlined manner. So if opening it up and ripping it apart and streamlining it differently, if there's cost savings that is being proposed, and you can't always be sure of that, but then also that individual, our services can we get the services to that individual and to those families in a better way? So we are looking at that. That's my only hope, is that maybe it would be positive.
Okay, next question. I am a health teacher locally for high school age students. Is there a development of an educational manual that can be provided to schools throughout the Commonwealth to help educate our students in regards to the opioid epidemic? I'll add one line on that. Get the attention of our young folks not to do it, either at the federal or state level. Or are there programs in place that are being ignored?
I don't know about a manual, but there is something that's called in plain sight that is being used in a lot of places. What is in plain sight? In plain sight is where schools and law enforcement are coming together and setting up like a mock bedroom, and then having parents come in and walk through that mock bedroom and see maybe a tennis ball, maybe a spoon, maybe a backpack, different things in a regular bedroom setting and they'll allow all the parents to come through that bedroom, and then after they walk through that bedroom and think that everything was okay, they give the parents an education into the tennis ball could have been used to hide the drugs. The spoon was used for a certain thing. It's really an eye-opener. It's being used in a lot of different areas, and it's a great program. I spoke with the principal here this morning about it, and it's something that we definitely want to look into and try and bring here into the high school. So, for the parents, yeah, it's for the parents. It's not for the kids.
And I have been I've been having discussions with the LIU to talk about putting together some type of program between law enforcement and these school districts to present to children. But we can't start at high school. We need to start much younger. It's unfortunate, but you're talking about, we see 10, 11-year-olds doing drugs. It's just unsettling. So we need to come up with a good program that we could use. That I've been looking into other states and what other states or other areas, for instance, Los Angeles, what they've been using in their school districts to try to educate their children. So we are looking at different options and trying to work with the school districts themselves.
The short answer, Andy, is yes. For that educator, Secretary Rivera, Department of Education, Secretary Murphy, Department of Health, all hands are on deck on the Wolf administration to get the resources to our schools. We can work with the various providers in our community. We can set up those programs, these public forums. That's why Congressman Barletta, myself, and Representative Toohil want to have these forums, so resources to our educators, because DA is exactly right. We have to start in our elementary schools to deal with this issue.
Okay, next question. How do you know that 80% of addiction starts with prescription drugs and not street drugs? And I don't know if this 80% is accurate, but that's the question.
Prescription versus illicit?
The question again is, how do you know 80% of addicts start with prescription drugs and not street drugs?
Because that's what they said. This is taken from heroin addicts. That was the statistic directly from them. Prescription opioid drugs.
I believe that's a SAMHSA factor figure, and certainly we compile our statistics, which are then reported to the state, which are then reported to the federal government, and what you look for, when did you start, what did you start with, what did that lead to? So the figures themselves, I don't believe 80% is the accurate figure. I think it's closer to 60 or 65%, but it's the self-report of the individuals who have sought treatment. That's where that figure comes from.
My number came from Pathways to Recovery in Hazleton, and it was 85%. 85% of heroin addicts are saying that they started heroin when their doctor cut them off from the prescription.
Okay,
So I thought it was a high number.
The figure that I came across was around 80 or in or around, but it's after then they could not get it from a medical source. They're going to the street drugs.
just this note, Pathway to Recovery has the mock teen bedroom. It was here at the high school last Sunday at the Suicide Prevention Walk and available for any group. It was sponsored by Hazleton Rotary. What is the outlook for medication-assisted treatments like Vivitrol and Suboxone? Is there uses for these drugs? Vivitrol and Suboxone?
There certainly is a use for these drugs. Vivitrol is an anti-craving drug. It's administered right after treatment. Individuals will get sick if they don't take it. And what it does for the outpatient, if it's administered to an individual, it gives when they get to outpatient or when they get to the next level with their physician, it gives them time to, the most dangerous time is in that 30 to 60 days after discharge, when an individual will begin to use again. So the relapse cycle for narcotics is much higher. So and the craving is really what it's about. And there's a very distinct difference here. There is abuse and there is addiction. There are people who are put on medications who abuse the medications, and when they are taken off it, they are okay. There are individuals who are addicted to the medication because they have increased usage, they have adverse effects, they have continued use despite adverse consequences, all of those things that make addiction a diagnosis. And craving for this drug is really our biggest issue. Suboxone and some other things that have been introduced, there is a population that works very well for. What we do know is that there is no magic bullet here. There is no thing that says this works for everybody. Addiction is a disease, and there are interventions that occur at different stages of the disease and recovery process. So if an individual has cancer, they may do radiation first, then they do chemo, then they would do surgery. Same thing with addiction. It's a disease, and it's a progressive disease, and if an individual, the dilemma, here's the dilemma. This is the other dark side of our addiction here, or this type of addiction, is that you die from this. You die quickly from this. And so in the rush to avoid the death, which is not wrong, we sometimes will maybe introduce interventions as a blanket answer. And there is no blanket answer. But there is a population who does very well on Suboxone. There is a population who does very well on methadone. There also becomes an issue of quality of life, just like there is in any other illness. If you have diabetes, it becomes quality of life as to how much you get. If you have cancer, it becomes quality of life. Do I continue with these interventions? Does it impact in such a negative way? But what it allows to do is that it gives you the time, because addiction is, if you have a true addictive disorder, you have life skills deficits and coping skills and communication skills and things like that individuals need to learn, and it gives people the time to do that. Some folks shouldn't come on. Some folks should come on. Some folks shouldn't go on. Some folks should. So it's a one of the things I can't stress enough is that it's a highly individualized thing with narcotics. It's not what we saw with alcohol. It's not what we saw with marijuana. It's a whole different scope, and there's a whole different pathology here, and it really we need to step back and take a look at individuals and individual needs, and environmental issues are huge in this issue, in this thing, because individuals start out maybe in a nice suburban area, and then they end up in a different world. Young girls who are 20 and 22 years old who maybe have to engage in activities, and young males who engage in activities that violate all of their morals and values. And that's more the issue, and that's the dark side of this. This is the part nobody wants to talk about, and because this is where it takes our children, this is where it takes our users. And so now you have other issues with trauma, and you have issues with, value compromise and guilt and shame and remorse, and then the fear that that's going to be exposed becomes overwhelming. And so there certainly is a value to therapy for those issues because they are so prevalent. And then in order to be able to provide the therapy, the guy's got to show up. And in some of these cases, with some of these medications, that's very effective. And for a good portion of the narcotic population, they respond real well to that. Some people are okay by the time they get out of inpatient care. Some people need 2 months, 3 months, 2 years. Some people need a lifetime, and can function really well. So there certainly is a place, and I think they're not going away. But one thing that I can't stress enough is it's not a magic bullet. It's not gonna take away the issue. One of the issues we're having with Suboxone is that the pain management folks, what they tell us is that 65% of the people on Suboxone go back again and seek some type of medication. So it's the old story. In God we trust, all others bring facts. When you start looking at the numbers, how some of this stuff works out, we have to peel the onion back and start to look at, okay, are we setting people up to fail by trying this intervention, by not trying this intervention? So it's little more, I guess there is a place for it. Is it for everybody? No. Is it for some people? No question.
Okay, what challenges, this is a law enforcement question, Chief. What challenges do you face in coordinating with law enforcement from other states as you work together to target the transfer of illicit drugs across state lines?
You know, there's no territorial touchiness here in Luzerne County. We work with the Drug Task Force. We work with the Drug Enforcement Administration. We have a Hazleton detective that is assigned to the DEA. So we work with our federal, state, and local counterparts. The NYPD has been here in Hazleton countless times over the last year. We've done jobs with the Philadelphia Police Department. The task force has been a tremendous, tremendous driver of us working across jurisdictional boundaries, and there has been no territorial touchiness since it's been taken over by the district attorney. It's just been phenomenal.
Okay, we have one last question, and a lot of these are repeat questions, so I'm not asking them. Let's just say, for the final question before our closing statements, does this really start at home? I mean, are we still, all goes back to family structure, what people have at home? Is that a big factor in all this?
I don't think that at all. I think that's the message that we're trying to get out to the community is, as District Attorney Salavantis was saying, it knows no boundaries. So there's no class. It's not impoverished people, middle-class people, rich people. Everyone is affected by this. It doesn't matter if you're black, white, Hispanic, male, or female. So it's not going to be just how they used to say, well, that kid was from the wrong side of the tracks, or, you know, we thought he was going to get into trouble anyway and end up with a life of crime and drugs. This is people that you don't expect. This is your loved ones. And hopefully people come out of here thinking, you know, I really need to talk more about this. I need to check my cabinet. I need to not be as judgmental, I think, of people that are having an addiction issue. You're lucky if you're not having an addiction issue, but you certainly have to be open-minded and I think willing to talk to members of the community about it, and the knowledge that you've gained tonight, go forward and share it with everyone. I think the times have changed, the drugs have changed, and that this is definitely not something that is your fault or something that started always in your house.
Okay, we'll have closing statements now. We'll start with Congressman Lou Barletta. Yeah, sure, Joe. What's the question? No, go ahead. And Joe, and thank you for being involved in the community all these years. You work for the community, you volunteer and stuff, so thank you very much. Thank you, Joe. Let's have our closing statements with Congressman Lou Barletta first.
Thank you, Andy. Again, I want to thank you again and WBRE for doing this. It's so important for the community, not only yourselves, but all the people who came out tonight, to come together, and that's how we solve issues. And as well as the panel, the great panel that took their time to come here, who realized that the only way we're going to solve this problem is doing what we're doing tonight, coming together, recognizing there's a problem, shining a light on it, seeing how we could come together and what we can do, and realizing that there's a lot we could do. We probably, many people will walk out of here tonight and really should go home and check their medicine cabinets and realize that that's probably the very first thing we could do to begin to fight this problem is do something that you learned here tonight that is a problem. And I want to thank John and Tarah for continuing to work together to bring these issues to the forefront. There's a lot of things that we could do. We talked about, instead of throwing people in jail, let's get them help. Addiction is a disease, and it can affect every family, and it has. And I think all of us probably have some personal experience with dealing with a loved one who is dealing with a disease, and we have to make sure that we provide the resources for them. One, realize that most people don't want to be like that. They don't want to be addicted. That's not what they want. For so long, people who were addicted to drugs were looked upon as if they were losers or something, they didn't care. They don't want to be that way. It's a disease, and it needs to be treated as a disease, as well as mental health. Many people suffer with dual diagnosis, not only with addiction, but with mental health issues. And I think it's time to come together as a country and as a community and recognize that. And we all have a role. We all have a responsibility. So I want to thank you all for what you did tonight, coming, and as well as our panel and my good friends, Senator Yudichack and Representative Toohil. Thank you.
Okay, thank you, Congressman. Senator Yudichack.
Thank you, Andy. Thank you to WBRE. Thank you to the panel. Most of all, thank you to the community, the greater Hazleton community that came out here tonight. This problem, it can be solved, but it can only be solved with community engagement. When citizens band together as a family, as a neighborhood, as a community to tackle a problem, to help, whether it's the children in the community or whether it's moms and dads, it's about community engagement. We cannot change the law. We cannot provide more resources to battle the opiate epidemic here in Pennsylvania unless there is strong citizen engagement. We see it here tonight. We see it across all the forums that we have in Pennsylvania. So please stay engaged, become more educated on this issue. We are becoming more educated each and every day. So thank you all for coming out. Thank you for staying engaged in this fight.
Very well said. Thank you for having this forum at this venue where there's a lot of access for the community. These types of forums need to grow so we can have panelists, like the fine panelists we had this evening, share and educate us on the issues and let us know as community members how we can start to tackle this problem. Kudos to the chief, the district attorney, and law enforcement. We have had many improvements in this area with regard to policing and having new police tactics, completely new methods of doing things. Almost immediately, people saw results. So thank you to Chief Speziale in particular for that. We have there's so much work to be done. Just to leave you with parting thoughts, 14 to 22% of pregnant women will fill a prescription for an opioid. 14 to 22% of women that are pregnant. In 2015, there were 2,691 newborns hospitalized being born drug dependent, and that number is growing. So we have much work to do. Dr. Mary Pascucci had spoken about today the news release that came out about the gray drug, a drug called gray death, that was part heroin, fentanyl, like that elephant tranquilizer, and part fentanyl, that it was so deadly that one little piece of it can kill you, and that you cannot breathe it in, that it is so deadly. It was found today. It was released in Bethlehem, Pennsylvania, and it's linked to 46 deaths nationwide. I think information and education on this is everything, that you have to speak to your children about this. They're trying to get it off the streets of Pennsylvania as quickly as possible by tracking where it was found. And when they did find it, it's very important to note, so the officers were advised to wear 2 pairs of gloves and analyze the drug while wearing a respirator and safety gear with gloves. And one of the other officers was equipped with naloxone in case it would kill them while they were investigating this. And this gray death was actually stored in a place where the woman, she had 3 children in her home, and all three of those children, it was within their reach in the kitchen. So this information is so important, and you need to talk to your family about it. And please spread the word, and thank you for coming.
I want to thank our 3 legislators for putting this together. And I want to thank all of you for coming. I would love to sit up here and take the credit, Joe, for everything you talked about. But without a partner next to me here that gives us the funding, helps my men and women out there with the task force, I wouldn't be able to do it. I want to tell you something. I've worked in many capacities and in many places over that 37 years. And the men and women of the Hazleton Police Department are truly a talented group of individuals that are dedicated to the welfare of the citizens. They're the ones that are out there doing the job. I'm just the coach. So they are doing a phenomenal job. They're out there day and night working to make a safer city. We talked about this whole entire panel, and I think that everybody has really that one common theme. It's coordination and collaboration with the community, because collaboration unleashes the power of the many to do what none of us can do alone. So my commitment to you and to everyone up here is I will be a partner with you and with the community until we battle this terrible scourge of drugs and crime until it's zero. So thank you very much.
Stephanie?
I, too, want to thank the legislators here for putting this forum together. It's very important that we all sit here and discuss these important topics. As everybody stated before me, we all have that common message. It's working together. And I, too, want to say, you are very fortunate here in the Hazleton area. You do have a wonderful, dedicated police department. Police departments, it's not even just Hazleton, in southern Luzerne County, that work so well together. I think that is what is helping change the future of our communities. And I want to applaud the work that they do every day. And like the chief said, we're like the coaches. It's the team that's really making us look good. And I try to tell them how much I appreciate them every day. And I hope that message gets out there to all of southern Luzerne County's law enforcement. But again, I want to thank everybody here. Please remember that if you see anything going on your streets, you know your communities better than anyone. Call 911, call your local police department and tell them they want to hear from you. That involvement with law enforcement, the community involvement, will help us combat the drugs being sold and hopefully reduce the number of fatalities that we're seeing. So thank you again, and thank you for inviting me here tonight.
Mr. Knowles?
Again, as everybody said, thank you very much. It's, there are two things I think. We're very blessed, I believe, to here in northeastern Pennsylvania, Luzerne County, that addiction is not as hidden as it is in some parts of the world. I travel quite a bit and have these conversations, and very rarely do I get to sit with the district attorney or the congressman, or it's usually you're somebody's secret friend, and we're trying to make this very anonymous. And because it's such a dark world, and I've said that a couple times, what we really need to do is shine the light on this, and I believe that in this area we do a very good job of that. And this is really the epitome of it takes a village. And people ask me all the time, what can we do? And you can get informed, and you can reach out, and you can be a part of the solution. And I was with the fellow the other night, and they said, well, no, doctor, what can we really do? And he said, pray. He said, pray for the poor guys that suffer. Pray for yourself that you don't have to. Pray that we find a solution, and love. Go out there and love each other and love your neighbor and be that. Because really, this is what it takes. I mean, this is eating away. It brings out the evil in the world that we live in. It brings out the evil people. It brings out the evil actions. And, left alone, this is impossible. It's impossible for an individual to beat this on their own. And so if nothing else, extend a hand, say a prayer, tell someone you love them, go home and hug your kids, clean out your medicine cabinet, and hug a cop, right? Sounds very good. Thank you.
Doctor, you have the last word.
Appropriate that I'm down here, although this wasn't planned, but I want to reiterate again that we got to take the stigma off this and put the light on it, like John said. This is your mother, brother, sister, boyfriend, girlfriend, your child. There is no face to this. There is no ethnicity. There is no real population. This is across the board through all economic walks of life. So you can't pigeonhole this. I do want to thank everybody at that end for what you do for the living, because quite frankly, we need to be more preventative, more proactive, because when they get to me, we have truly failed. So again, thank you, and for the presentation.
And thank you to everyone who came out tonight, and we'll see you at the next forum. Thank you. Have a great night. Be safe.